Morning everyone, this is Dr. Michael Yoon from Century Wellness. Friday, Saturday, we were at the marathon event, checking people's gait and movements, and there's a lot of people who are being very active and wanting to stay in good shape and do some endurance and cardio and go for a nice marathon run, which is really good for the heart and for the well-being of the health in general. However, I did notice at the event there's many people, even though they have very good cardiovascular health, their movements and mobility and biomechanics is not really up to par. Especially as they run longer over a period of time as they get older, that's gonna lead to some trauma and repetitive stress in different parts of their body, from their foot that rides up to their knees, into the hip, and to the spine, and etc. I just want to share this morning. I try and keep myself as limber as possible. Obviously, at 52 years old, our body gets a little bit tighter and stiffer, and we're not the same way as we are in our 20s. However, keeping the body stretched out and having a good mobility is key component of preventative health. Morning is our body is pretty stiff from waking up. And when you wake up, you don't want to jump right into stretches and potentially strain or sprain different types of tissues, such as your ligaments or your muscles. So keeping the body nice and warm and keeping it limber is crucial. So usually I like to use a heat pack that you can microwave I put it around my neck, I put it on my lower back to allow better blood flow to that area. Then you have a bit more elasticity in your tissues. And I like to do more global stretch. I like to do stretch from neck, mid-back, to the lower back, and to the legs and the spine and the wrist. Nice space in your backyard, or even in in your living room that has a lot of space. And I like to start out with kind of mobility to the neck, stretching out the cervical flexors and as well as extensor. And you don't want to over stress these areas, but you want that nice and easy mobility. And then we're going to go side to side, again stretching the whole entire neck muscles on the back side as well as the front, and gently kind of rotate side to side. Mobility, more blood flow. Okay, and you can go all the way up if you can, but if you have some neck degeneration and arthritis, I recommend just kind of keeping it a half circle like so. And I go with the shoulder range of motion, a little bit of external rotation, same time internal rotation. And if your shoulder allows you to, some of you may have problems such as your rotator cuff or bursitis. Just keep it at this level. But if your shoulder is able to, I like to kind of get that elbow engaged. Same thing, external rotation, and then internal rotation as well. And then from here, if you're allowed to, you can kind of create that nice circular motion. You don't have to go fast. Same thing. Double shoulder width apart. And I create nice, easy swing rotation to my waist. So this allows stretching to the back side of the muscles into the glutes, and same time it's stretching the opposite IT band and causing stretching to the abdominal area. And your arm is actually almost like a weighted pendulum. And you can see from my foot, I'm actually going on my toes, creating a tippy toe. I interlace my fingers, I stretch. So many of us use too much computer. We're always typing away. So all these muscles that connects from your wrist to your elbow gets overworked. So you want to be able to stretch those flexor tendon, the flexor tendon that curls your finger. Okay, and then you can go into the middle. And as I bring my hand into my chest, I take a deep breath in through my nose and then exhale through my mouth. Good, inhale. Then I can go a little bit higher. Good, inhale and exhale. My waist, I'm gonna gently use my left hand as I'm creating a fulcrum That fulcrum allows a little bit of guided push on my waist, allowing this muscles called serratus anterior, latissimus dorsi, into the oblique, and quadratus lumborum, IT, and glute to stretch. Opposite side, stretch it again. Now keep in mind, if you have back problem, you have herniated disc, or severe chronic degenerative changes, it is recommended that you see a healthcare provider, chiropractor, massage therapist, physiotherapist that could help you correct the situation. In our clinic, I do a full assessment. I do an examination, history, and some imaging, and we do things that allows the tissues to loosen up, but also we work with the alignment of the spine and allow the disc and the joints to be nourished as well. Now, once the body is corrected, we do need to do some regular mobility stretches. That's what I'm showing you right now. But once again, if you have actual condition that limits you from doing these kind of exercise, don't push it. You're gonna hurt yourself. And the last thing you wanna do is injure yourself so you can't really move at all. Knees, you wanna just kind of gently bend it. Good. And then come back. Good, bend it again, and you're gonna hear some popping and clicking noise in your joints. And those popping and clicking noise are quite common as we age because our joints rely on synovial fluid that allows lubrication and mobility. However, as we age with repetitive stress or trauma, these synovial fluid could dry up. That's why drinking a lot of water, taking supplements such as glucosamine, chondroitin, MSM is key component, along with proper mobility, stretching as well. Okay, then we want to do a little bit of rotation of your knees. Again, mobility is key. Okay, you don't want to overstress. And I'm gonna turn, keep my foot up, and use my hand on the kneecap. You don't want to press too hard, but you want to apply a little bit of pressure. And this stretch allows stretches to the Achilles tendon, the soleus, and back of the hamstring. I want to turn and just stretch, and I feel it all around these muscles. All these muscles here and here, which there's a nerve called sciatic nerve. And if these muscles are tight and your muscles don't really move, the sciatic nerve and fascia underneath, they start to stick. And when they stick, it can cause irritation, which therefore may cause some sciatic nerve problems. More open. And using my hand, I use almost like a cup, and create a little bit of percussion around the inside of the thighs, outside of the thighs too. Again, that allows better blood flow. Then I want to just grab my hand, almost like this. Grab my finger here or here, it doesn't matter. And from here, without falling, and of course, if you have a little bit of low blood pressure or you get dizzy, you got to be mindful of these things. Make sure when you do this, do it in a very safe manner. You want to lean forward and stretch. This is a really great stretch for your legs, your hamstring, your chest, and then come back again, and then stretch. And back, which is wonderful. Now I want to grab and hold the bottom. Now if you can't reach, you use like yoga block, right? Put it right in front of you. That allows you to kind of hold and support, and then you can have a little bit thicker one so you can't touch the ground. So for me, I can touch the ground, no problem. Some people may have problem. And from here, I want to slowly, and if you have knee issues, again, be mindful. Don't do this if you can't go all the way far. If you want to just kind of stretch here like this, I'm fine with that. But if you're able to kind of go down and just guide it down, allow hamstring to stretch out, the calves to stretch out, and hold it for a few seconds. Same thing, other side, lean, and just stretch out. Now from here, I want to turn, put my right knee on the mat, left knee in front, This stretch allows stretching of the right hip flexor. So basically the muscle connects from your lumbar spine into the hip joint. These hip flexors really shorten, they get tight, because what do every day? We're sitting down all the time in front of the computer, sitting down with your legs 90 degrees. So this is a really good mobility to stretch the hip flexor, the thigh, the rectus femoris, all the quadricep muscle. On the opposite side, again, I can use this block to give me a little bit of balance if I can reach. Left leg straight. And this stretches the hamstring, the calf once again. Okay, and then forward again, stretch. And you can look up. As you look up, not only are you stretching the hip flexor, you're stretching all the cervical muscle, the anterior component. Okay, once again, we're sitting in front of the computer. What do? We always kind of look like this. You want to stretch all the scalenes, the SEM, open up the chest, open up the abdominal area. Wonderful stretch. And lean forward and stretch the opposite side. Okay? Same thing on the other side. So I can use this. I'm stretching the left side of the hip flexor. Good. Now once I stand, I'm on my knee, and I can kind of stretch the back muscle. Stretch the posterior rotator cuff, the lats, lower back. And I can do cat and camel kind of stretch. And then curve up, down, up. Another thing that we want to try and practice is, a lot of times we tend to sit on a chair, sitting down, and this does not open up the hips. So I like to sit cross-legged, read my books, be grounded on the floor, use a yoga mat. And if you can't sit cross-legged like this all the time, you can kind of open it up. So practicing opening up the hip joint is pretty important. Doing some squatting, sitting like squat is also very good for the joint as well. And a lot of times, people tend to be at the garden, they're always on their knees, or they're pulling. So be smart about how we actually sit. You can use a little stool to sit down, get out, move around. Don't sit for hours. Don't stand for hours. I've seen some people say, well, I have a stand-up desk, and instead of standing, sitting, I stand for 5-6 hours, and I'm developing some back pain. Well, practice common sense. If you're standing every hour, sit down even for a few minutes. If you're sitting every 30 minutes, get up for every few minutes. Your body is not designed to do the same repetitive things for a long period of time. Our body needs to move, mobility, and keep the body nice and loose. So therefore, when you do have sports that you play, or even if you fall, okay, your body that's more mobile could have much quicker rehabilitation and recuperation compared to someone who is very rigid, and that rigidity can cause not only muscle problem, but eventually muscle tendon attached to the bone and joint, and that could cause some joint disorder, this problem as well. So once again, thank you very much for listening to me. This is Dr. Michael Yoon. I hope this information and this little video is helpful for you. Have a great weekend. Take care.